Nerve inflammation and nerve damage. How does that coincide with endometriosis or surgery for endometriosis? And what are some helpful ways to manage it? Let's talk about pelvic nerves and how to potentially reduce inflammation and possibly repair damage. So sit tight because we're going to delve into what the core pelvic nerves are, the types of endo-related nerve issues, and natural remedies that just might help. Endometriosis itself can cause nerve damage and irritation, either forming directly on the nerve or near the nerve. Even the formation of an ovarian cyst can put pressure on certain pelvic nerves. Personally, I've experienced frequent urination, bowel dysfunction, constipation, bowel frequency, dyspareunia, which is pain or discomfort during sexual intercourse, right shoulder tip pain courtesy of diaphragmatic endometriosis, lower back pain, and even leg pain. Now, some of these symptoms can be said to be linked to nerve irritation or sensitization of the nervous system. I actually managed to completely get rid of my femoral nerve leg pain symptoms with exercise, including physio exercises, all of which is accessible in this pinned post. But my bladder, bowel and diaphragm related issues remain, so I decided to have surgery. Now, many of you will testify to this, that surgery resulted in new or more pain symptoms because nerves were, let's say, tampered with. So as much as I wanted surgery to treat my endometriosis and remove it, I feared the prospect of nerve damage just as much. The pelvis is full of nerves. Some are vital to organ function. Most are small and, let's say, less significant. Nerve damage can mean anything from the loss of bladder function to new pain symptoms, places you've never felt pain before. It all depends on what nerves have been affected. Now, I've seen and heard countless accounts of women who experience more intense pain, even new post-op pain. The most common I've come across so far is leg pain, a lot of which I see reported post-hysterectomy, and also issues with bowel and bladder function. Now, when it comes to surgery, nerve damage is a possible risk for everyone. So I discussed this with my endometriosis specialist, and you can find out who he is right here. I asked about neuropelviology and nerve-sparing surgery. He explained that he's trained to work around the major pelvic nerves to mitigate any risk to them. But then there are the many small nerves within the pelvis, which will inevitably be damaged due to surgery, as they're more or less impossible to avoid. This can result in symptoms such as pain, numbness, and tingling. The good part is, small nerves are likely to regenerate. More on that in a mo. So what are the core pelvic nerves, you ask? The sciatic nerve, which we're all familiar with. The pudendal nerve. Think of your pelvic floor function and sensations within your private parts. Gluteal nerves, which as named affects your glute muscles, your tushy. The femoral nerve runs down through your groin into the leg, hence leg pain. And the hypogastric nerve. This one regulates pelvic organs. Think of bladder and rectum function and sexual function. So those are the nerves that you definitely want kept intact during surgery. Now, when I decided to proceed with surgery, I made a plan. The surgeon will take care of the surgery, and it's on me to prepare my body for surgery and take care of it afterwards. I looked into nutrition, and I looked into holistic therapies. Firstly, I researched supplements that I could take safely both pre and post surgery. From my stack, which I share here, the following nutrients are said to generally aid nerve health: magnesium, B vitamins, and vitamin C. And then we have my absolute favorite supplement for endo, PEA. I've spoken about this bad boy before. If you want to learn more about it, make sure you give this a watch. PEA is said to protect our nerve cells and reduce neuroinflammation. Its anti-inflammatory action results in benefits such as pain relief. Clinical trials have supported PEA's efficacy, its effectiveness, when it comes to chronic pain and inflammation, particularly with endometriosis-related pain, as well as, get this, neuropathic pain, pain caused by damage to nerves. I can't stress enough how incredible this supplement can be for women with endometriosis. Honestly, if you want to give one new supplement a try, invest in PEA, especially if you're experiencing body-wide inflammatory pain or you're about to go in for surgery. I was taking PEA way before my surgery to help manage my endo pain symptoms naturally. After surgery, I waited until about 3 to 4 weeks when I was back on a semi-normal diet because of my bowel resection. I take 2 capsules in the evening before bed together with my magnesium, and I sleep like a baby. If you're interested to give this a try, tap the Shop Youth and Earth link in my bio. Make sure you apply code LENA15 for 15% off your order. Another supplement worth considering after your excision surgery for endometriosis is Youth and Earth's Nerve Growth Factor. Its key ingredients are lion's mane mushroom, rhodiola, and ginseng. Together they work to support the production of nerve growth factor, which is a protein that plays a key role in the growth of new nerve cells, their survival, and it helps repair damaged ones too. At the same time, this supplement concoction is lowering stress, supporting the immune system, and boosting cognitive function, helping with mental fatigue. Again, I started taking this a few weeks after surgery, taking 2 a day first thing in the morning as recommended, and I feel good for it. No pain whatsoever. So how many of you experience what you believe to be nerve pain, either because of endometriosis itself or because of surgery to treat endometriosis? Has anything helped you? If you do want to give either of these a go or just the one, be sure to tap the link in my bio and apply code LENA15 to get that 15% off.